Video lecture chapter 18, part 2, diseases caused by microorganisms. So we're going to talk a little bit about viral diseases. So there are at least 5 types of viral hepatitis, and each is caused by a different virus, A through E. Hepatitis A can affect anyone, spread from person to person when something is put in the mouth that has been contaminated with the stool of the person with hepatitis A. This is called fecal oral transmission. Good personal hygiene and proper sanitation can help prevent hepatitis A. So we're always going to wash our hands after changing diapers or using the bathroom. This is the least serious of viral hepatitis. A vaccine is available that provides long-term prevention in persons over the age of 2. Hepatitis B is a very serious disease that may result in prolonged illness, liver cancer, cirrhosis of the liver, liver failure, and even death. Bloodborne disease that may also be transmitted in other body fluids, including saliva. Anyone who has ever had the disease and some persons who have been exposed to but have not actually been ill may be carriers of HBV and may actually be spreading the infection to others. This presents a high risk for dental personnel because dental treatment brings them into direct contact with saliva and blood. So the hepatitis B immunization is highly effective vaccine. It's available to prevent hepatitis B. All dental personnel with a chance of occupational exposure should be vaccinated against hepatitis B. The OSHA bloodborne pathogen standard requires that the employer offer hepatitis B vaccination at no cost to the employee within 10 days of initial assignment to a position where there's a chance of occupational exposure to blood and other body fluids. As the employee, you do have the right to refuse the offer of the vaccination. However, the employer must sign a release form indicating that the employer did offer the vaccine and that the employee understands that there's potential risk for contracting hepatitis B. With hepatitis C, it's most efficiently transmitted through blood transfusion or percutaneous exposure to blood. The carrier rate for HCV is higher than that of HBV. There's no vaccine against hepatitis C at this time, nor is there a cure for the disease. Treatment, though, is available to control effects of the disease. Hepatitis D, a defective virus that cannot replicate itself without the presence of HBV. Therefore, infection with HDV may occur simultaneously with HBV or with an HBV carrier. Persons with co-infection of HBV and HDV often have more severe acute disease and a higher risk of death than those who are infected with just HBV alone. So the vaccine against HBV will also prevent infection with HDV. Hepatitis E is not transmitted through bloodborne contact. It's most frequently transmitted by way of fecal oral routes through the contaminated food or maybe water. HEV is most frequently seen in the form of an epidemic in developing countries. It's not a major concern in the standard dental setting. Human immunodeficiency virus, HIV, is a bloodborne viral disease, an infection in which the body's immune system breaks down. AIDS is caused by HIV. When HIV enters the body, it infects special T cells and then slowly kills them. As more of the T cells die, the body's ability to fight the infection is going to weaken. A person with HIV infection may remain healthy for many years, though. AIDS is considered to have developed in HIV positive person when he or she becomes sick with serious illness and infections that occur with HIV. HIV is spread by sexual contact with infected person through needle sharing amongst drug users. Now that blood is screened for HIV antibodies, the blood supply in the country is safe. Babies born to HIV infected mothers may become infected before or during birth or even after birth while breastfeeding. In non-dental healthcare settings, workers have been infected with HIV after being stuck with needles containing HIV infected blood. Herpes simplex virus type 1, a viral infection that causes recurrent sores on the lips. Because these sores frequently develop when the patient has a cold or fever of other origin, the lesions have become commonly known as fever blisters or cold sores. Primary herpes, this disease, which is highly contagious, makes its first appearance in very young children, 1 to 3 of age. It's known as primary herpes. The child may have a slight fever, pain in the mouth, increased salivation, bad breath, a general feeling of illness. The inside of the child's mouth may become swollen and the gingiva would be inflamed. Healing begins naturally within 3 days, and the illness is usually over between 7 and 14 days. So, supportive measures can be taken to make the child more comfortable, relieve pain, and prevent secondary infection. Recurrent herpes after the initial childhood infection, HSV lies dormant and then would reappear later in life as the familiar reoccurring fever blisters or cold sores. Herpes simplex virus type 2, genital herpes, is the most common sexually transmitted disease in the United States. Initial symptoms generally appear 2 to 10 days after infection, tingling, itching, and burning sensation during urination. Once a person is infected with the virus, outbreaks will occur. A mother with active vaginal or cervical herpes lesions at the time of delivery can then pass that virus onto their newborn. Major transmission route for herpes virus is through direct contact with lesions. Even when there's no active lesion, there's still the possibility of transmission of the virus through saliva or aerosol spray from the dental handpiece. Because there's no prevention vaccine against herpes, it's essential to take precautions against exposure. So we want to wear protective eyewear and then also gloves. West Nile virus is commonly found in Africa, West Asia, and Middle East. Has likely been in the United States since the early summer of '99. The virus is carried by mosquitoes and can infect human beings, birds, horses, and other mammals. Affects a person's nervous system, causing inflammation of the brain and the spinal cord. Symptoms include fever, headache, tiredness, aches, and then sometimes a rash. We have H1N1, the flu virus, not related to previous or current human seasonal influenza virus. New H1N1 virus spreads very easily from person to person. Most effective way to protect yourself is to receive the vaccine and practice hand hygiene. Bacterial diseases include tuberculosis, laryngitis, tetanus, syphilis, and methicillin resistant. Tuberculosis, the leading cause of death resulting from infectious disease worldwide. HIV and tuberculosis are also often present together. Tuberculosis kill time is the benchmark for effectiveness of surface disinfectant. Laryngeal pneumonia causes 2 acute bacteria diseases, Pontic fever and laryngitis disease. Bacteria are transmitted through aerosol and aspiration of contaminated water. No person-to-person transmission. Tetanus is also known as lockjaw. It's extremely dangerous and often fatal disease caused by spore-forming bacillus found in soil, dust, or animal or human feces. The disease can be prevented by administration of a vaccine. However, immunity must be kept current through booster doses. Syphilis is a STD caused by Trichomonas pallidum puricetes. Bacteria are quite fragile outside the body but can cross-infect the dental operator through contact with oral lesions. MRSA is a bacteria that's resistant to some antibiotics. Infectious can be Infections can be on the surface of the skin and can go into the soft tissue and form a boil or abscess. So we always want to maintain good hand hygiene practice. Never squeeze or try to drain any sore. Keep any wound covered until it's healed. And don't share personal items like towels, razors, sheets, or clothes. A pandemic disease is a global disease outbreak. It occurs when a new virus or disease emerges for which people have little or no immunity to, and there's no vaccine available. In addition to illness and death, an especially severe influenza pandemic may cause severe disruption resulting from school and businesses closing and interruption of public transportation and then also food services. This concludes our video lecture of chapter 18.